afternoon. My name is Kristen. I'm the co-founder of RX Live, and I'm a clinical pharmacist. Thanks for joining me today. Today, I wanted to talk to you about joint replacement. If you are among the 1 million Americans scheduling surgery this year for joint replacement, then you know there's a lot to consider. As a pharmacist, I've seen many patients at the pharmacy counter turn in prescriptions for joint replacement surgery. And I've learned over the years that there are a number of important medication considerations, which I'd like to share with you today. I have 5 key tips. The first is to get your medications filled well in advance, at least 1 week before your surgery. This is because oftentimes medications prescribed by the orthopedic surgeons are quite expensive, and your insurance will require additional paperwork called a prior authorization before they agree to pay for the medication. You don't want to find this out on your way home from the hospital. My second tip is around medications that increase the risk of bleeding, like aspirin, ibuprofen, Aleve, warfarin, Eliquis, among others. Oftentimes, these medications need to be stopped up to a week before surgery to decrease the risk of bleeding complications during surgery. If you forget to stop taking these medications, your surgery will likely have to be rescheduled for your safety. My third tip is around pain management, which is key after surgery. Your doctor may choose to write you a prescription for a narcotic pain medication. Be sure to read the directions fully and only take the dose as often as prescribed. Also around this topic, many insurance companies and states limit the amount of pain medication that can be dispensed to 1 week. If you need more than a week's supply of narcotic pain medication, you'll need to have your doctor write you a brand new prescription for more of it. This is also not something you want to find out on a Friday night with 1 tablet left. My fourth tip is around clot prevention. Your doctor will write you a prescription either for an injectable medication like enoxaparin or an oral tablet like Eliquis. You'll need to take that medication for around 5 weeks after your surgery. It's important to complete the full course of therapy, even if you're feeling better, because this prevents DVT, or deep vein thrombosis clots. My last tip is to make sure that your doctors know each of the medications that you're taking, including prescriptions, over-the-counters, herbals, and vitamins. Your pharmacist can print you out a personal medication record and add your herbals and OTCs to that list so that we're all on the same page, improving patient safety. Well, I hope that you found this helpful today. Thanks for joining me, and best of luck with your joint replacement surgery. For more information, check us out at rxlive.com and follow us on our blog. Take care. See you next time.